Many obese adults have been having weight loss surgery for years, but now a new study says that it's also becoming popular with overweight teenagers. But is that a good idea? Here with details is our own Dr. Jennifer Ashton. Good morning, Jen.
Good morning, Maggie.
So we should note that this is a study that came out in the very reputable Pediatrics journal. What did it find?
Well, they were really looking at trends, Maggie, of who exactly was having obesity surgery in an adolescent population. So they looked at the state of California, a 2-year period from 2005 to 2007, found that there were 590 teenagers who underwent obesity surgery, and this is in the age 13 to 20-year-old age group.
And in those 590 adolescent surgeries, did they break them down further?
Well, what was interesting is they did find ethnic differences, they found gender differences. For example, in this population, they found that 28% of those who had surgery were white teenagers. However, 65% of them underwent surgery. Now, this is a little bit counterintuitive because there were 28% represented the overweight teenagers, but 65% of them actually had surgery. So among white teenagers, more are having obesity surgery than are obese.
Exactly, I understand that. Either way, when I heard about this, it's very alarming because it's such a drastic thing for a young person to do.
It is. Now, we know in the adult population, Maggie, obesity surgery is the gold standard for permanent weight loss. With more and more teens and children being obese and overweight, we are starting to see the treatment for that kind of go over to that age group. Now, again, when you talk about something drastic, you have to weigh risks versus benefits. The benefits of this in the teenage population is that we will hopefully be able to prevent the diabetes, the high blood pressure, the high cholesterol that we're starting to see in teenagers who are already obese. Why wait till they're 20 or 30 to start treating that when some people say you should start treating it when they have the disorder? However, you always have to talk about risks. You and I talk about that all the time.
Are there greater risks for surgery if you're a teenager versus an adult, this particular type of surgery?
This study did not find any higher complication rate amongst teenagers or children. They still saw the same complications that they see in adults, which could include anything from bleeding to infection. Depending on whether or not they had the lap band or a gastric bypass, those sites can leak and cause infection. They have the same immediate post-operative complications, lung problems. They could see kidney failure in the hospital. All of these were not seen in a higher rate in the children or teenagers than we see in adults. But again, we're seeing more and more of this. We also should note, Maggie, the lap band, which is very popular, is not FDA approved yet for use in children. So the company that makes the lap band is starting to apply for that, but we're going to see more and more.
It hasn't been around that long, so I guess they don't really know how it'll affect
No, about
children.
A decade. So again, we're going to be looking at long-term. How do these people do 10, 20, 30 years after the procedure? And that is going to be very important.
All right, Dr. Jennifer Ashton, thank you so much, Jen.